Well, thank you for the invitation. And you notice after my name it says retired. Someone accused me of being pathologically retired recently. And the fact that it says retired after my name indicates that I don't have to say that the comments are not necessarily those of the government. But that has never stopped me anyway in the past. What I want to do is set the stage for how I will approach the ethical issues in elder mistreatment. This IOM workshop is part of a global violence prevention initiative, and I was initially concerned that only 3 of the 5 major forms of elder mistreatment are considered violence: physical abuse, psychological or emotional abuse, and sexual abuse. On the other hand, science indicates that the consequences of financial exploitation, and certainly of those we heard from the last panel of neglect, both self and other neglect, are quite similar to the 3 other forms of elder mistreatment that are generally considered a violence. Research demonstrates that victims of all types are vulnerable to increases in mortality, morbidity, depression, institutionalization, impoverishment, disability, dependence, guardianship, learned helplessness, and now with the work of Melissa Simon and Xinqi Dong, we know that there's twice the rate of hospitalization of people that have been victimized. And the occurrence of elder mistreatment is only now becoming recognized as a major, significant social problem. We've been bantering these data around all day, so I thought maybe it'd be a good time for someone to present them. There are really 4 studies that I want to emphasize, and really only 2 of them. One is by Ron Eschierno, who we've heard from extensively today, which indicates that these are the 1-year incidence estimates of elder mistreatment, and that it has approximately an incidence, a 1-year incidence of 11.4%. There's some variability in that based on what you put into the equation. And the other one is, though not a national study, is one by Mark Lax, which is the state of New York, in which, and I'll bring these data back in a moment because there's something fascinating, I think, about that, that indicates that, the incidence in that particular study is 7.6%. I think it's fairly reasonable to estimate that the overall estimate of elder mistreatment in the U.S. at least, the big study is Great Britain, and the Lauman study is also U.S., but it has some, I think, methodological problems with it, that the overall incidence indicates that somewhere between 2 and 4 million people a year over the age of 65 are victims of elder mistreatment. And given the demographic imperative, that number certainly will be increasing. And it seems to me to be higher, the evidence indicates that it's higher in certain racial and ethnic groups, which is something that I haven't heard too much about today, that I think really needs to be concentrated on. And the problem of the incidence is even worse when you consider the underreporting, this iceberg phenomenon that we have been talking about. There's an earlier Sentinel study that AOA sponsored that was fashioned after the work on child abuse that dealt with a Sentinel approach, and they found that less than 0.5% of the elderly had a recognized form of elder mistreatment. That low number is probably a function of 2 things. First of all, I think it's probably a lack of recognition on the part of professionals, which we've heard frequently today, as well as due to some methodological issues with Sentinel approaches as opposed to direct surveys. And again, that's the iceberg issue. The problem is that the actual occurrence of elder mistreatment, is significantly greater than those that are reported to adult protective services. And that's the function of this next slide. These are the data that Mark Lax and his colleagues collected in New York State, in which they looked at all types of those forms of elder mistreatment, and found that the ratio of self-reported elder mistreatment, you can see it up there, okay? All forms of elder mistreatment, the ratio of all forms of elder mistreatment that are documented, that is reported to APS, versus those that are reported in self-report is 1 in 24. So 1 in 24 cases are reported to elder mistreatment or documented by elder mistreatment. And financial exploitation, that goes up to 1 in 44, and with neglect, 1 in 57, given all of the problems we've already discussed in the last panel on neglect. However, our scientific knowledge, based on our scientific knowledge about elder mistreatment, is, I think, really basically quite lacking, and that's the ethical issue that I want to address in this brief time. I'll leave to my colleagues some of the related issues of IRB and HIPAA issues. We've made significant strides in our work, especially after the National Academy, National Research Council, and NIA, this is an NIA-sponsored book in 2003. But there's too little research attention paid to elder mistreatment for a variety of reasons, still a decade after that book was published. The NRC published that book and created what they called, quote, a foundation for a much-needed scientific effort in elder mistreatment. Since then, I think, as I said, there's been some funding progress in the field and some significant research progress in the field. NIA created a research solicitation, an RFA, that was able to get nine grants at approximately $350,000 per grant for two-year grants, and they funded several unsolicited research projects since then to several people who are in the room now. NIJ just published its next FOA, Financial Opportunity Announcement. That's FOA, Financial Opportunity Announcement, and they've done at least one in almost every year for the last almost decade, at approximately $1 million a year. NIA, by the way, is funding still at a rate of approximately $1 million a year. ACL, through ACL and AOA, recently awarded a number of grants on prevention intervention programs in community settings. The Archstone Foundation a few years back had a solicitation on elder mistreatment, but that was in California. And the Kendall Charitable Funds, I just discovered, are just announced a pilot funding in elder mistreatment. And as far as I know, that's it in terms of research, in terms of research funding. Well, in the last decade, while research seems to have grown rapidly, especially given the starting base that we had a decade ago, there are two areas I think that we are ethically irresponsible for not looking more carefully at. And I'm sure there are more, but these are the two that I find to be the most striking for their lack of knowledge and for their ethical criticality. The research issues surrounding the Adult Protective Services Unit, which we've just heard from Kathy, wherever she disappeared to. Anyway, from Kathleen Quinn, I'm sorry, and prevention issues, and they're clearly significantly related. Let me start with APS, Adult Protective Services. Societal, legal, and ethical. There's a societal and legal and ethical mandate to do something. I think those are even Kathleen's terms, if I'm not mistaken, to do something for abused individuals. And the APSs around the U.S. have created a number of interventions, which I would almost prefer to call actions as opposed to interventions, because I don't want to mix that up with the science that comes with the term interventions. A number of actions to deal with elder mistreatment, support groups, emergency placement, legal action, and that sort of thing. However, and realistically, APS does not have the expertise to evaluate those actions or those interventions. And that's the role of research, to produce evidence-based interventions or science-based interventions. Yet there is precious little research upon which these interventions that APS uses is based. For example, does institutionalizing a victim work? Okay, in terms of it certainly gets them out of harm's way to a degree, but there are other individual issues, individual expectations that may militate against that. Is it always ethical? It sure is expensive to institutionalize an individual, both monetarily, socially, and clearly psychologically for the individuals. How is APS expected to deal with cognitively impaired individuals or victims? Or for that matter, how do they even assess cognitive incapacity in the field? There's been some recent fascinating and frankly, I find a very surprising exchange on the National Center for Elder Abuse listserv. And if you're not on that website, you ought to, I suggest that you get on that. Some fascinating stuff goes on there. And that what I was surprised by is there was a question that someone raised, I'm not sure where they were, on what to do with a cognitively impaired individual in terms of nursing home, emergency nursing home placement. As someone like myself who's more attentive to research issues, I was really kind of surprised at the what to do with question that seemed to come over the website. I would have thought that that would have been settled long ago. There were multiple options that were suggested by practitioners in the field, but not one of those suggestions said, based on evidence, X is what you need to do with those individuals. None of them evaluated options that were available to APS for this individuals. Again, please, I am not criticizing APS. APS has got to do something, as Kathleen said. That's what they're legally structured to do. And it's not necessarily incumbent upon them to do research in the field on alternative interventions for the individual. It's our responsibility, the research community's responsibility to test alternative interventions in concert with the APS community. There's got to be a reasonable, reliable, and consistent funding mechanism to create and evaluate those interventions and ultimately to translate them into settings that work within the APS community. And also regarding Adult Protective Services, there's a wealth of accumulated experience that they've gained in the years that they've been doing, quote, doing something in the community. And the research community needs to make use of that experience that they've had. With the exception of several elder abuse specialization centers or forensic centers or integrator centers that Carmel Dyer talked about around the U.S., there is very little interaction between practice settings and the research settings. There have been some attempts to integrate APS with research, especially at these centers, but that effort has really been it needs really to be a partnership, or APS will continue to do what it has to do to work with the victim without the benefit of science-based evidence or evidence-driven interventions. I realize this is a two-way street, and not at all an indictment of our science, nor certainly not an indictment of APS. But there is an ethical imperative to test the interventions that APS must use to do its job. The second of the two ethical, I believe, imperatives in doing research goes back to something that Pam Teester had said earlier when she was presenting a number of models, and it really comes from a public health knowledge, and that is prevention. This also obviously can be subsumed under APS interventions, but I think it's really a broader issue than just within APS. There's an ethical imperative is even more generic than the APS issues. There's growing knowledge about the risk factors for elder mistreatment in general and for specific types of elder mistreatment in particular. And several of the people that spoke this morning or throughout the day talked about some of these risk factors. AOA even has a one-pager, a flyer, that lists some of the risk factors that are found in the literature. And indeed, our scientific literature is full of those kinds of risk factors. And there's a good deal of this research looks at the risk factors that are associated with the victim. We've heard about social isolation, we've heard about social incapacity, we've heard about poor physical health, about low social support. And some of the research even looks at the perpetrator, mental health issues, substance abuse issues, social stressor issues. But elder mistreatment itself is a team affair. It takes a victim, typically. It takes a victim and a perpetrator. There is very little research that I've seen in the literature that looks at the interaction between those two factors that lead to elder abuse. Most research deals with just kind of half of the equation, and certainly none of them deal with the ecological model that was talked about this morning, putting both the perpetrator and the victim within a social context. We need to create a theoretical structure. Thank you, Pam. We need to create a theoretical structure that looks at the social and statistical interaction of the two involved in the elder mistreatment, as well as the ecological environment within which it occurs. This is especially true given that we are reasonably confident that elder mistreatment typically takes place within family settings. So there's an ethical imperative to begin testing interventions to prevent elder mistreatment, primary prevention rather, as well as the reoccurrence, which is secondary prevention. And there's a desperate need for these interventions to be evidence-based so they can be used within the community. Without this, we will continue, I believe, to intervene in ways that we really have no way of knowing whether these interventions work. APS will continue to operate in a scientific vacuum, even though they have an ethical imperative to do something about the mistreatment. Given our growing knowledge of risk factors of both victim and perpetrator, we need primary interventions, I believe, to prevent elder mistreatment before it occurs in community settings, and we need secondary interventions to assure that what APS and the police and the prosecution and the prosecutors and others are doing is effective and cost-sensitive and timely. Finally, why the ethical lethargy, if you'll excuse the creation of that term? Why the ethical lethargy? There are too few researchers. First of all, I think there are too few researchers doing work in the field. This room right now is probably filled with all of the really great scientific minds who are doing research in the field, and that cadre is about it. Okay, there are just too few researchers doing research in the field. And you guys are it. But NIA, for example, had an initiative about a half a dozen years ago in which we solicited, based on the NRC, the National Academy of Science work, based on the work that they had done, in which we solicited a number of grants with research funding. The grants were excellent. They came up with some excellent outcomes in terms of methodology. But the problem, one of the major disappointments that I had in creating that initiative was that there was only one person that we funded that wasn't already involved in elder mistreatment work. That there was an attempt. It was really an attempt not only to advance the field, but to get other people who were not involved in the field. There were some successes in attracting. There are some successes in attracting and training others. Mark Lack's work at Weill is outstanding in that regard, but it's a very difficult area in which to do research for all the reasons that we have mentioned, and I'm sure that my colleagues will amplify on that point later. But I think there's too little research because primarily there's too little money flowing into the field, and I did this I did this as an analogy between what we spend in funding cancer and what we fund in cancer research, and what we fund in spending in elder mistreatment. The numbers are very crude, okay, and I flip around in years because those are the last data I could find, okay, but they're pretty close. So if you'll take a look at that, I don't have to look up there. I've got the screen right here. That's very good. The estimated new cases, according to the American Cancer Society, they estimate that in 2012. There will be approximately 1.6 million new cases of cancer diagnosed in the United States, and of those above 65 years of age, there will be about 848 cases of cancer. That number, it comes from a publication of the American Cancer Society, and is based on some of the SEER work. SEER is a cancer registry that I believe NIH maintains, if I'm not mistaken. So that the cases per 100,000 population of cancer Above age 65 will be approximately, per 100,000 will be approximately just over 2,000 people will be first diagnosed with cancer in the year 2012. Okay, for elder mistreatment, using a weighted average between Mark Lack's work, fast, which is, granted, New York State, not a national survey, and Ron Asierno's work, the weighted average of approximately 9.8% indicates that the number of new cases of elder mistreatment discovered in the United States will be almost 4 million, or were almost 4 million in the year that we were dealing with. I'm using a base population estimate of 40 million elders in the United States and 313 million people in the United States for the overall cancer estimate. If you take a look at look at that disparity, you'll find there will be just under 10,000 new cases of elder mistreatment in the U.S. as opposed to 2,100 new cases of cancer in the United States. And if you take a look at the investment that NIH has made in cancer, it's $5.1 billion. And the investment that NIH has made in NIA, the National Institute of Aging, that's $1.1 billion in 2012. And our estimates, and this is where it gets a little squirrely because I don't know what we've spent in 2012, but certainly in 2009, the amount of money that was put into elder mistreatment research by the National Institute on Aging is $1.1 million. And GAO's report, which was published in 2011, indicated that in that same year, 2009, and again, these are the last data that I could find on this, the federal government invested just under $12 million in elder mistreatment. That includes approximately $1 million research from NIA, approximately $1 million in research from NIJ, and the remainder of that is a great deal of programmatic work from ACL-AOA. So while I think there has been some significant progress made with the creation of the Elder Justice Coordinating Council that comes out of the Affordable Care Act and the Elder Justice Act, which is now part of the Affordable Care Act, and certainly with the work that the Elder Justice Working Group has been dealing with, I think that there is an ethical imperative somehow to get additional monies into the area of elder mistreatment. It is clear that it is going to be a growing problem in the society, especially given the numbers, and we have to consider what our investments in research are likely to be. So that's it.